Hello, and welcome back to the Parenting and Pregnancy Podcast, where I sit down with experts, parents, and other individuals and have conversations about all of the things relevant to you through pregnancy, childbirth, parenting, and beyond. So if that sounds like something that you might be interested in, consider subscribing so that you don't miss any new episodes. This week, I'm sitting down with Annette Weller, a certified nursing midwife in the Black Hills region. Annette lives with her family in the beautiful southern foothills of western South Dakota. Her personal birth experiences have included hospital and birth centers, including epidural, all-natural, and cesarean birth. Her experience as a nurse began in 1990 and included 4 years of home birth assisting, birth doula work, 2.5 years in a high-risk labor and delivery unit, postpartum and newborn nursery, neonatal intensive care unit, pediatrics, the emergency department, and home health nursing. As a part of her training, she attended births at Monument Health and provided hundreds of women's health exams in local OBGYN clinics. Her master's degree in nurse midwifery was granted by Frontier Nursing University in Kentucky, and she is board certified by the AMCB, the National Certifying Agency for Nurse Midwives. She is a firm believer in autonomy and options when it comes to giving birth and supports women's desires for birth whether in or out of the hospital. Her goal is to provide women with low-risk pregnancies with safe, satisfying birth experiences in the comfort of their own home. As a mobile midwife, she offers home visits for prenatal assessments and other women's health concerns. Individualized care and shared decision-making are important aspects of building relationships for continuity of holistic care, family satisfaction, and optimal birth outcomes. She is committed to investing time for each visit and providing safe, evidence-based care and education to her clients. She considers it an honor and a privilege to be with women during this exceptional season of life. In this episode, Annette and I discussed a lot of the basics about how home birth midwifery care looks and what you can expect to experience. We also discussed a little bit about criteria for whether or not a home birth is right for you. We're discussing what prenatal visits look like in the home and what your actual birth experience will look like and different safety measures that are taken and so many other things. So if you're considering a home birth, you're curious about a home birth, know nothing about home births, anything like that, I'm sure you will find something in this conversation interesting. You'll probably learn something as well. So without further ado, let's get into it. Okay, Annette, so I know that you're a home birth midwife, right, in the Rapid City area or Black Hills area. And I know a lot of people who are considering home birth kind of want to know what kind of the difference between your experience with a home birth versus a hospital birth. And one big difference is the prenatal visit. So I kind of wanted to ask you, what does a home birth prenatal visit look like, and how does that compare to a prenatal visit for like OB care?
Okay, sure. So initially, we'll start off the same way as you would if you go to a clinic. We'll do a little physical exam. We'll get prenatal lab panel, pretty much the same kind of labs. You have a little more options. Some places don't let you decline any labs, whereas we can talk a little bit more about what labs you might not want to do. Um, and then at your regular visits, we'll listen to baby's heartbeat. We'll measure fundal height to make sure that the baby's growing normally and fits within the measurements that they should at that time. We'll check your blood pressure. And we'll talk a lot about your preferences for the birth, what's happening with your pregnancy, looking forward to, what to plan on for follow-up visits as far as further testing that we'll want to do, or ultrasounds, going over ultrasound results, making recommendations for what your options are. So we want you to be a partner in your healthcare. A lot of times when you go to the clinic, they just tell you, this is what we're doing, and you just kind of have to fall in line with what their procedures are. Whereas with home birth and with having a midwife, you have more flexibility. Your midwife will talk to you about what your options are and what is best for you, because maybe you're not comfortable with certain things. So we try to educate you on what the evidence says and on what we recommend and what truly is an option for you, because some things are okay to decline, just so that you understand what the risks and benefits of different interventions are. And we don't really like to, use interventions that's probably not a good word, but different things that can help you to have the healthiest pregnancy. So, you want to make sure that you avoid the risk of infection. So, maybe a lot of women want to avoid antibiotics in labor. So, we can talk about ways to be proactive to try to prevent having a positive group B strep result, or maybe even if they do and they don't want to have antibiotics, we can reassure them what the evidence says and then plan accordingly. So maybe they don't want antibiotics, but maybe we say, if your water's been broken for a while, we should probably reconsider that. So, anyways, that's probably a long way around the barn. But we do talk a lot more, get to know each other. We spend a lot more time with the home birth visits and the prenatal care, just getting to know one another and understanding what the family's desires and preferences are. Whereas at an OB office, you have a few minutes and the doctor does quick checks and you're on your way, and you really never get to know that person very well. And when it comes to the birth, you might not even end up with the same provider that you've seen through most of your pregnancy. So this way, there's a lot more continuity of care.
So better continuity of care, a little more personable, right? Because you're having those
Mhm.
longer visits, longer discussions. Um, what about for those moms who maybe aren't sure? Like they aren't really familiar with Group B strep, or they've heard different things, and so they kind of have an idea now, and they're not sure if they'll change their mind later. How does that work? Maybe in a mid with midwifery care, um, with the home birth, maybe somebody says that they're open to antibiotics and then they get into labor and maybe they're a little less comfortable with it. For one example, since that's what you brought up,
Mhm.
is it pretty flexible to kind of
Yes. So
explore different options?
we do talk about what their preferences are. Some people know right away. They've done their research and they know what their desires are. Um, for example, how about vitamin K too? Some people aren't sure. They're kind of on the fence. They don't know if they want to administer vitamin K after the birth. And I'll tell them, well, I'll bring it to the birth and you can keep thinking about it and you can let me know then. We don't have to decide today. I just want you to be thinking about it, continue to look over. I provide informational handouts and they can go and do more research on their own if they like. But I'm very flexible and I feel like that's best for families. We talk them as much as we can prenatally about what their options are, but sometimes they just need time to, think and digest the information until they can come to what's best for them.
Okay, so you're pretty flexible about kind of looking into things. And what about those mothers who maybe this is their first go around, or they kind of defaulted more just to what their doctor said without looking into things further, and so they're wanting to learn more? Do you provide a lot of education, like for those moms who maybe don't know what Group B strep is or vitamin
Mm-hmm.
K? They don't know what that is. Do you provide a lot of that? Like you don't need to know this stuff to have a home birth, right? You can learn it along the way.
Right. Right. Yeah. And I do. I post a lot of information and educational resources to each person, each client's their electronic health record, so they have access to their personal health record. And in in a way they don't, because they don't really read all of the visit notes. I can send them access or send them copies, but they fill in their own personal information, their own personal health history, and then there's a whole page of documents which provides a lot of information. So not only do they have their informed consents, and I post their ultrasound reports to that page, but they also have a lot of educational resources. So I can refer them. And then at certain points in their pregnancy, I'll also email them those. So several times they're getting, the information that they kind of need to review before they make those decisions.
Okay, so you're providing a lot of different education,
Mm-hmm.
um, and it's something that can be kind of explored and looked at all the way throughout pregnancy.
Yes.
Okay. Um, and so, if this is something people are interested in, at what point in their pregnancy do they pursue going this route? Or when do you recommend that they reach out to you or a home birth midwife in their area?
Well, midwives have very limited availability because we want to be fully present and available for everyone that we're committed to. So we can't just take, a dozen clients a month if we're working by ourselves. that's not really sustainable, and it's not really fair to other clients if you're overly busy, you're just not available because you're at another birth or haven't had time to recover from a birth. So I recommend people, if they know they want to have a home birth, or even if they're thinking about it, to reach out to a midwife as soon as they know they're pregnant, if not before. We can't really reserve a spot for somebody that's not pregnant yet, but just so that they can help them to make that decision. They can ask the questions that they have ahead of time. But then as soon as they get that positive test, we really like to hear from them so we can get them on our list. If they need an early ultrasound or have any problems along the way, we can be getting them set up for care early on. Availability usually does fill up pretty fast.
Okay, so you recommend kind of as soon as you find out you're pregnant, you really establish midwifery care just as quickly as you would like with a regular OB, right?
Yeah, right away is better, because if you wait until you're, you know, 16, 20 weeks pregnant, your midwife might not have a spot. So it's important to reach out right away. Even if you don't start visits right away, it's important to let your midwife know that you're interested so she can work with you to determine whether you're an appropriate candidate for home birth, and then just to reserve a spot for your birth month.
Okay. And then what if a mom is kind of going down a traditional route, so she's going to regular OB appointments or maybe midwife appointments for a midwife that delivers in a hospital, and then down the line, like middle of her pregnancy, let's say, she starts learning about home birth and then it's something that she's interested in. Is there ever an opportunity to transfer into midwifery care if there's
Yes, yes,
availability?
absolutely. Yeah, I mean, and that does happen sometimes. And I'm
Okay.
totally open to that as long as they have availability and they're an appropriate candidate for home birth. I definitely do take transfers. Some
Okay.
months end up being lighter than others, so sometimes, it is possible to get in mid-pregnancy. So it's always worth giving a call and seeing.
Okay, so it's a possibility. There's no guarantee that there's a spot, but there's nothing
Mhm.
prohibiting someone from transferring care if there's availability.
Right.
Okay. And so I guess one thing that maybe would prohibit care is as a home birth midwife, right? We know home birth is safe for many women, but
Mhm.
not for every woman. So maybe explain to us like what is within the scope of a home birth midwife. What kind of clients are you taking on, and patients, and what is maybe better suited for an OB or like a hospital birth.
So home birth is really only appropriate for healthy women with low risk pregnancies. So if you have a history of preterm birth, you might be excluded from planning a home birth because there's a greater chance that you'll have preterm labor. So that would be a little bit more high risk. If you develop preeclampsia during pregnancy, you might be able to start care with the home birth midwife, but then you would have to transfer to a higher level of care. Or if you develop gestational diabetes and were unable to control your blood sugars with diet and exercise, and you required medication, you would also need to transfer to a higher level of care. um, Multiple. So if you're pregnant with twins or more, or if your baby is breech, initially your baby's not going to be breech, but at the time that you're due, if your baby is breech and we can't get the baby to turn, you would be disqualified from planning a home birth. So there are definitely factors that can exclude women from being an appropriate candidate for a home birth. And there are other things. If you have a history of maybe cardiac disease, diabetes, just type 2 or type 1 gestation or gestational diabetes that's uncontrolled with medications, those kind of things, then you would need to see a regular OB because you need more specialized care. We specialize in the normal. So when things start to deviate from normal, we need to either consult with a physician or possibly transfer care.
Okay. And what does transfer of care look like?
Well, it depends. A lot of times women will know maybe they've had a hospital birth before and they have an OB that they feel like they would like to go back to the certain person. So I would call that provider and talk to them, and then just send their records over and they would start seeing that provider instead. Sometimes I need to recommend a certain provider. So if a woman needs to see maternal fetal medicine, maybe there's a concern with her baby that they found on an ultrasound, or maybe even with her own health, there's something that we're concerned about. I might need to refer her to maternal fetal medicine, which you don't really get to pick and choose with them because there aren't a lot of options. But the one that we do have here is amazing. So I feel really comfortable sending women to see him when needed. And so I would just fax their records over. A lot of times have a phone conversation with the person that we're consulting with, and then the woman would get a call to set up an appointment time to meet with them. And usually they would make the decision as to whether they are still an appropriate candidate for home birth or not.
Okay, so just
And they
because you're
would make a
consulting
recommendation.
and they'd make a
What's that?
recommendation. So just
Mm-hmm.
because they're consulting a physician doesn't necessarily mean they will need to transfer care,
No,
but that's the safest way to determine that. Is that kind of what you're saying?
right. Mm-hmm.
Um,
Yeah.
well, that makes a lot of sense. And I'm glad that we can kind of work together as a team. And by we, I mean all the different providers, um, to make sure that women are getting the right level of care.
Yes.
Um,
Yeah, that's super important to have good collaboration with our team so that our client can get the best and most appropriate care.
okay, that's great. So we've kind of talked a little bit about prenatal visits and what that looks like before going into labor. But what about when you go into labor as a home birth client? Who is there? Like, is it just you? Does somebody come with you? Who can the other person have at the
Mm-hmm.
house? Can you maybe go into that, what that looks like?
Sure. Clients are welcome to have whoever they want at their birth. A lot of clients want to have their children there. They just either they want them to be a part of the birth, or they just feel more comfortable not having to worry about, how their children are doing. So they just keep them at home. And obviously the partner's there. Sometimes they hire a doula. I especially really recommend that for first time moms because they need a lot of support, and it really does help the partners to know how they can best support their partner in throughout labor and the birth. And just kind of, it's a very educational experience to have a doula there to help you get prepared as well. As far as the birth, usually I come first, and then depending on where the woman is in her labor, I might be calling my assistant to join me there, meet me at the client's home. Or if it's going to be, things are a little bit early, I'll usually wait to call my assistant when it's getting closer to time for the birth.
Okay, so you're not the only one there that's trained in home births, right? There's always another when it's time for the delivery, there's
Mm-hmm.
another person there, right?
Right. Yep. Yeah,
Okay,
my
and what are the
assistant will usually
benefits of
come.
that?
Well, we need extra support. It's really awesome to have an extra set of hands because it's pretty busy when a baby's coming. We have lots to do. And we're checking vital signs on mom and baby every half an hour, helping mom get breastfeeding established. We're bringing her nourishment, making sure she's comfortable, making sure her bleeding is controlled, making sure the baby's transitioning well. And of course, there's the cleanup. A lot of times we have a birth pool that we need to, empty and tear down. And just all the things that help to make a mom comfortable and support her well after the birth. So it's really important to have an extra set of hands, at least one. And a lot of times even the dad will, do things to help out as well. So
So, lots of support then. There's
mhm.
usually the partner, there's you, there's an assistant, and then kind of whoever else the family wants to be
Yeah.
there.
Yeah,
But you
sometimes
don't
the,
have
the
any sort of
woman will want
restriction.
her mom there, or she has a friend or a sister that's there, and that's extra special if there can be other family there. But I'd say in general, most of the time it's just the partner and maybe one or two children, and then my assistant. So
Okay. Um, and what are the benefits of maybe having a home birth? I know it's nice to be able to kind of have whoever you want there, um, and a lot of people like to labor at home. But what are some of the other benefits of giving birth at home and having your prenatals at home, kind of all of your care at home?
right. Well, I feel like for the family, they're in their own environment. And that's important on so many levels, but they're just so much more comfortable. The problem with going to the hospital is a lot of times your labor stalls, your adrenaline kicks in, you're in this clinical environment. It does not feel comfortable to you. You have all kinds of strangers coming in and out, and a lot of times doing procedures that you don't really like, starting an IV or putting you on monitors, and it's just not a comfortable environment, so it's hard to relax. So your body can't do what it needs to do. So of course, then, they want to start augmenting your labor because they feel like things aren't happening very quickly and they want to keep things moving. Whereas at home, you don't have to deal with any of that. And it truly is a normal physiologic process. So we treat labor and birth as a totally normal physiologic process. Whereas in the hospital, a lot of times it's not treated that way or it's not supported that way. So it doesn't happen that way.
Okay. And you
Um,
said
yeah,
oftentimes they'll start augmenting. Can you
mhm,
explain to those who don't know what augmentation means or to
sure.
have your birth augmented? Can you explain what that means?
Well, that is like the first intervention a lot of times that happens in a hospital birth, where we give a woman a synthetic hormone that makes her uterus contract. It doesn't really make labor work like your own physical oxytocin works. So it's made to work similarly. So it will help you to have a baby, but it does not allow your body to labor as normally. You just start getting really hard contractions, and they're not really a break, and a lot of times it really stresses the baby, so it's a little riskier for the baby. And the mom is not able with to build her own endorphins to kind of cope with labor as well, so it becomes more stressful for the mom and a lot harder to deal with that kind of labor. So a lot of women will go into the hospital thinking that they want to have a natural labor, but because the things aren't moving along, maybe they have the white coat syndrome where everything just kind of freezes up when they get there. They get the pitocin and it's just so uncomfortable, and they're not able to get up and move around. And a lot of times they're stuck in bed with monitors on, and if they get up and move around, it's hard to keep the baby on the monitor. So then they end up deciding that they need an epidural because they're just so uncomfortable and they know they have a ways to go. And so that's another intervention, is the epidural. And then they're not able to move around. So they're not comfortable, they're not able to move around. And then a lot of times the baby's not able to be in an optimal position for birth. So the nurses are coming in and turning the mom a lot because now she's not really able to do that for herself because she's numb from the waist down. Um, so all of those things lead to problems that can end up resulting in a C-section a lot of times, or in a birth that a woman is very unsatisfied with the way her labor went and the way her birth went, only because of all of those interventions. Whereas at home, labor just happens and we're just there to support mom. We're just there to kind of keep an eye on things, make sure that things are progressing normally, that the mom and the baby are doing well, and just to support her in however her birth goes.
Okay, so you're kind of supporting this physiological birth, this kind of natural process. Um,
Mm-hmm.
but what are signs? And I imagine most of the time this kind of goes as planned because you're only taking on those low risk women. But what are some signs during labor where you might decide that this isn't going kind of in this natural path that we'd expect, even though there's variations of normal? It's not looking normal, or there's some concerns. What are those signs, and then what do you do when that comes up?
Mm-hmm. So we do spot checks on the baby's heart rate, and so you don't have, like at the hospital, they'll put monitors on you that stay on. Whereas we just use a little Doppler, and we listen, every 30 minutes or so, just depending on what stage of labor you're in. And we'll be listening to the baby through contractions and after contractions, just to make sure that they're tolerating labor well, that their placenta is working well, that there's not pressure on the cord or something happening. If we start to pick up that the baby's not tolerating labor well, we'll transfer to the hospital. Or if the baby is starting to have what we call late decelerations, where there's a subtle drop in their heart rate after contractions is kind of sustained, that's concerning because the baby's not getting enough oxygen. So if that does not correct through repositioning the mom or hydrating the mom, we need to probably transfer to the hospital.
Okay.
Those are generally kinds of things. Most of the time, moms transfer during labor because they're exhausted and they're ready for an epidural. Honestly, sometimes those things do happen where the baby's in distress, or we just see concerning signs that we think we need to get to the hospital. But a lot of the times a transfer is not really emergent. It's just that the mom is really tired. Maybe it's a first baby and they take a little longer. And a lot of times those first babies can get in there a little wonky and it's just more work to get them out. And they're just totally exhausted and want to go get some rest. And so for them, the hospital is an okay choice. And we
And so
would,
that's
just
okay.
yes. And a lot of times, mom will transfer and get her epidural. And because she's able to rest and able to relax, the baby comes quite well. So every
Okay,
labor
so
is
just
different.
because,
And
go ahead.
well, I was just going to say, every labor takes a different path. Not every labor goes like we expect or want it to, but we just kind of have to go where it leads us. So sometimes that's the best choice for mom.
Okay, so even though you should be pretty committed, if you're having choosing a home birth, that's something
Hmm.
you want to do, you're not locked into it, correct? You can get into it and
Oh, yeah.
decide that you'd rather go to the hospital, and that's still an option, right?
Yes. Yes. Hmm.
Okay. I think that's helpful for parents to know that if something starts to get uncomfortable, there is that option. I think that's a great option. And then, so what does that transfer of care look like when the mom's already in labor and she is transferring to the hospital?
So I would just call ahead and talk to the nurses in labor and delivery, let them know that we're coming, and then they'll contact whoever's on call, or perhaps, if they have a provider that they would like to transfer to, I can ask if they're on call, and we can choose someone. Maybe they've seen that provider, prior to, maybe they transferred care to me somewhere along the line, or they've had that provider for another birth. And sometimes we're able to, check in and see if that person's available. But I would just go with the family to the hospital and get them settled, give the nurses report. Depending on the situation, I may be able to stay and just offer support, like a support person for the birth, but not always. It just kind of depends on hospital visitor policy, how many people are already there for that client, and what they desire. And maybe, maybe this is a first time mom who's been in labor for a really long time and we all just need to get some rest. So it really depends. So
Okay.
usually it's a really, smooth handoff. I just give the nurses report and they're able to take it from there. And then if the client desires, a postpartum visit from me after they go home, I'm available to do that as well. So I would still be checking in with them just because we've developed that relationship and we're really invested in it. So I would be checking up to see how things are going and if they need anything.
Okay. Um, and that's a good point. You just mentioned postpartum visit. So, are postpartum visits standard with your care?
Oh, yes. So after the birth, usually about 24 to 48 hours after the birth, I would come back to their home and check on mom and baby and also do the newborn screen. That's state required. And so I would collect that. And then I would be available to, come and do weight checks, or if there's any concerns, maybe needing breastfeeding support or anything like that, I would be available to stop in and help the mom. And then we always do a 6 week postpartum visit as well. So kind of, if they need a pap smear or if they need help with birth control, just to kind of make sure everything's returned back to normal. They don't have any concerns, any problems with postpartum depression going on, all of that. So I always try to stay in touch. Even if everything is going well and they don't have concerns, I try to check in with them pretty regularly up until the 6 week point.
Okay. So it's really from kind of the time that you find out you're pregnant, ideally, all the way through like at least 6 weeks postpartum that you're involved in the care and support. Is that
Mm-hmm.
correct?
Yes. And if there are any concerns with the baby, I would refer them. So, up to 28 days of life, I can be the primary provider for that baby. But if there are any concerns that develop, maybe the baby gets jaundiced, um, maybe there's, a physical concern that we need to get checked out, there's something that's abnormal in their newborn exam, I would refer them to someone else for care. So, a pediatrician or family care provider.
Okay. So mom through 6 weeks and maybe even beyond, and then baby up to 28 days if things are going as we
Mhm.
expect.
Yep.
Oh, okay.
And other than that, I'm always happy to, do a weight check or whatever, just to make sure baby's gaining appropriately. If mom's concerned and she doesn't have a good way to, check weight. Sometimes they have a concern with tongue tie, so we might refer them to a dentist or someone who can do laser surgery to kind of clip that or at least evaluate it. Sometimes they just need to be evaluated for
Okay.
that and they don't have it, but sometimes they're concerned because they have other children that have had it, so they like to get it checked out. And it's better to do that sooner than later.
Okay. So you can do different referrals
Mhm.
and kind of walk through some of these things with the new families.
Yeah.
Um, okay. And we're kind of jumping around a little bit, but we talked about some of the benefits of home birth. And kind of what that looks like, but I don't think it would be a complete conversation or like wholesome conversation if we didn't address some of the risks and kind of discuss how we mitigate those because there's benefits and risks to everything.
Hmm. Okay, so risks for home birth. Um, it's really hard to say because the studies that we have don't have a lot to say about the risks. They are difficult because a lot of states do not get information when there's a home birth as to even whether it was a planned home birth or not, and whether it was an unassisted home birth. So maybe it was planned to be at home, but there was not a professional there to make sure everything was proceeding normally, or whether some other care was needed. So um, according to the studies that we do have, there is a slightly increased risk of neonatal death, but those numbers don't really mean a whole lot when they don't take into account as to whether it was even, planned home birth or not, or whether, someone that was trained was there to attend the birth.
And what
You're
training?
obviously you're not at a hospital, so you would not get care maybe as quickly as needed if a true emergency did happen. So say you have a cord prolapse, there's ways that we can get the mom to the hospital hopefully quickly, but if it's somebody that chooses to birth in a more rural location, it might take a little longer to get to the hospital. There are measures that we can do to try to protect the baby, if there was a cord prolapse. um, but that can be a little bit scary, if you have to travel an hour to a hospital and the baby's not doing well.
And so is that why you're a little more selective of who is it qualifies for a home birth then to kind of mitigate those risks?
Well, obviously you don't know, prolapse cord is a really random thing, but obviously you want to have low risk pregnancies. So you know for example, a VBAC, so a mom that's going to have a vaginal birth after cesarean, um I would feel more comfortable with that plan if we were a little closer to a hospital, just in case. The risk is really very low for, say, for a uterine rupture with a VBAC, but there still is some risk. And sometimes there's a problem with the placenta, maybe not separating as it should. And so there's retained placenta and more bleeding. So just for those reasons, we might want to be a little bit closer to help so that, mom's life is not in jeopardy. But I
Okay.
feel like the real question is, what are the risks of a hospital birth? Because I think it's more risky to have a birth in a hospital a lot of times, because
Okay.
there's a greater risk for having a primary C-section in a hospital instead of just relying on the normal physiologic process and just allowing that to happen. A lot of people are in a hurry and they just want to get induced, and it's not time yet, and that can really wreak havoc on your labor experience and how your birth goes. And I think a lot of people don't realize that you need to be patient. As long as things are progressing normally, it's really not in your best interest to try to rush things.
I like that you brought that up to look at not just the risks of home birth, but the risks of hospital birth, because I think sometimes we keep those ideas separately. So that's a good point. What would you say? So you mentioned one risk is higher chance of cesarean, and then kind of that those interventions. Where that like what is known as the cascade of interventions, like you were talking about, where maybe you get a
Mm-hmm.
little pitocin, and then you need an epidural, and baby's not tolerating things well. We're moving around, and sometimes this leads to a C-section. Sometimes it's longer pushing, tearing, whatever.
Mm-hmm.
Are there any other risks of hospital birth that you can think of?
Mm, let's see. Kind of caught me off guard. I just feel like it's super risky. So I think that even they don't have a very high tolerance level for VBAC. So women that really want to have a VBAC have a harder time in the hospital when it would be really bad. The risk of VBAC is actually much lower than the risk of having another C-section. But I don't think
Okay.
that women are really taught that because that's a major surgery and that C-sections really do affect your future births. So surgery is super risky too. So I think that there's not a fair presentation of the risks of having a C-section. They really try to scare women a lot of times out of having a vaginal birth. And the thing with out of hospital VBACs is we're not doing anything to augment labor or to induce. So that risk is even lower. For as low as the risk is for a VBAC birth, if you're going into the hospital, the risk is higher because they are often doing things to augment your labor,
Okay,
which is
and
more
that's harder on
risky.
your body?
Well, and it puts you at a greater risk for a rupture when they're giving you Pitocin, or there's a lot of things they don't give you when you're having a VBAC because they're too risky. But they will
Okay.
still induce women and augment labors when they're doing a VBAC.
And is that related to those contractions you were talking about with the Pitocin that
Mm-hmm.
are stronger and your
Mm-hmm.
body's not getting a break in those endorphins? Is that what you're referring to that kind of makes
Mm-hmm.
VBAC a little riskier? Is that Pitocin?
Yes. Mm-hmm.
Okay. So we talked about the benefits and the risks, and then also the risks um, of a hospital birth, and then we were kind of talking about um, we've talked about what the hospital birth might look like a little bit when it comes to the people that are there and kind of the process. Um, but one thing I think a lot of mothers are curious about and maybe unfamiliar with is comfort measures during labor at home because we don't have access to those epidurals or spinals or different medications that can um, help with pain. What kind of natural comfort measures do we have for home births?
Well, a lot of women love water birth, which most hospitals don't offer. And water is truly a natural way to relieve discomfort and just to help to make you more relaxed in labor. Um, so hydrotherapy. Not it's not for everyone. Not everybody chooses a water birth. Not everybody is happy with a water birth. They decide they don't want to do it next time. But so many women have found it so helpful and they just love it. And some women like to just labor in the birth pool. They don't necessarily want to give birth in the birth pool, but they like to labor in the birth pool. So it enables them to relax, to just allow the normal process to unfold and to be able to cope with the stronger contractions a little bit more. I don't recommend it for early labor because you can get too relaxed and then everything kind of stops. But once women are really uncomfortable, either sitting in a birth pool or standing in a shower, which a lot of hospitals will allow you to stand in the shower, but you have to get out so you can get back on the monitor. So you're pretty limited if you're allowed to get in the shower at all at the hospital. And then obviously, food and drink is a huge thing at the hospital. They often don't want you to have anything to eat or drink when your body's working hard. And a lot of women don't actually want to eat a lot in labor, but fluids are super important. They need to keep their energy up. And your body can't, if you're dehydrated, your body can't work as well to have effective contractions. Obviously, in the hospital, they mitigate that by giving you IV fluids, which can lead to other issues. So, being able to just be in your own environment, have move around, have your own personal food and fluids available, and having a support person there to just provide comfort for you, to do different things, counter pressure or whatever you need to be comfortable. So I would
So the
say that a huge
doula
thing
is a
for
big
home birth.
part.
What's that?
So a doula is a big part of some of those comfort measures.
Yes, I really encourage doulas. I think that they're underutilized. We need to have more people use doulas, and I feel like a lot of couples that um I attended their births, it's not their first birth, and so they don't have a doula. but maybe they have before. So they've kind of learned a lot from the doulas, and then they picked up a lot of things along the way. So there's not always a doula, but they are an excellent resource, and I highly recommend them.
So a doula can be really helpful with helping with those comfort measures and teaching the comfort measures, whether it was with your first
Yes.
birth or the
Yeah, and
current
just making
one.
suggestions. Yeah, making suggestions to the family, like what to try next. So a lot of times, maybe mom's having back labor, it's really uncomfortable, and it's because of the way the baby's kind of sitting in there. So we know that, and there are different tricks that we can do to kind of help that baby to turn so that their labor can end more quickly and the mom is not as uncomfortable. Once that baby can rotate into a better position for birth and for mom's comfort. There's a lot of things that they can, tips and tricks that doulas can offer to help moms throughout labor and make sure that she's, drinking often. Moms tend to forget that. So just having things handy for her and providing whatever support she needs.
Well, that is really helpful information. Um, what is your service area?
Well, I cover um, as far south, I'm located near Hermosa. So I cover the area down through Custer and Hot Springs, up through Newcastle, Moorcroft, Sundance, Hewlett, up above Hewlett, and then over to Spearfish, Newell, Union Center, and then of course Rapid City. I haven't had any clients over by the wall, but I would go there. I haven't had calls from there. So it's about a 2.5 hours north and maybe about not quite down to the Nebraska border there. That's kind of remote there. I've had people call me from Nebraska. It's just kind of hard to figure out where we could have their visits since I do home visits and they can't have home births there. So it's a little bit trickier getting into that area, but I do cover eastern Wyoming and then the Black Hills. So for
Okay.
people to see me, there's people that are pretty far spread out. I will go to home births that are 2.5 hours away, but they'll come to see me in Spearfish. So if there's people in the Northern Hills, I have clinic days about once a week in Spearfish, and they'll come to see me there.
Okay, for their prenatal visits.
Yes.
Okay. Um, and how can people find out more about you, get a hold of you?
Okay. Well, my website is blackhillsmidwifery.com, and my email is blackhillsmidwife@gmail.com, and my phone number is 605-209-2197.
Okay, and I'll put all of that in the show notes or the description for anyone who wants to find out more. But thank you so much for taking the time to answer these questions, Annette. And I think it's really helpful for those maybe curious about home birth, looking into home birth, completely unsure what home birth is. So I really appreciate it.
No, you're welcome.
All right. All right, guys, I hope you enjoyed that conversation between me and Annette. If you're interested in learning more about Annette's services, go down in the description, and everything is linked down below. If you like this podcast, consider liking it and subscribing in whatever platform you use so you don't miss the next episode. Thanks for watching. I'll see you in the next one.